Dr. Lindsey here. This video is fairly long and detailed and goes through the strip repair of an FUE case. And it's an unfortunate guy who flew to Turkey and had 3,500 FUEs. He could have had the same problem right down the street. The video goes into the difference between strip and FUE, trouble with donor depletion, and the technique that we use to repair him. So it skips around a bit. It's hard to do a long and involved topic like this all at one sitting while you're trying to do a case. So bear with the scene changes, and I hope it can explain kind of what goes through my mind when I see a patient for the first time, and particularly when we see these patients that come in for repair. Part one is really strip versus FUE. We do 130 strips a year and 30 or so FUEs a year, and they're ideal techniques for selected problems. The advantage of strip is it's not terribly expensive, it's pretty quick. If it's done at the right office, you tend not to get much of a scar, and there's very little trauma to the hair, and because there's no trauma to the hair, the success rate is really high. But the cost is a linear scar, and not everybody gets good scars, and not everybody sews well. FUE is ideal for patients that have thicker hair. I discuss a bit in this video how hairs are like plants, and skinny plants tolerate stress less than fatter plants do. FUE doesn't leave a linear scar, which is the big advantage. That's a marketing advantage, particularly to the automated tool manufacturers. The downside, though, is that it costs more. It's much more labor intensive for the doctor and the lead technician, and the time out of body for grafts is significantly higher. I did an FUE on my own son. He's got thick, bushy hair. He had 50-cent size scar on the side of his head from previous surgery, and it was ideal for Wyatt. He healed in and grew well. I put pictures of him at 4 months out. And in fact, he's about 8 months out now. I just saw him with a short haircut, and the trouble is now he's a little too thick in the area that we fixed. So FUE definitely works, but it works best in smaller cases and with thicker haired individuals. And the trouble is that a lot of these guys who roll into my office for strip or FUE have really fine hairs, and so FUE is an option for them, but maybe not the best option. So look at this video. This fella had FUE, but he's a strip. We did a strip repair case on him, and even with his fine hairs, we have to be particularly gentle with those grafts and get them back in the body as quickly as possible. So with FUE, here is a one hair follicular unit. The black part is the skin. This is the hair shaft. So you take a rotating punch, and you can do that with a machine, or you can do it by hand. There's a couple automated machines out there that say they can do it better than human eye. I'm skeptical of that, particularly the one that makes the cut and then suctions out the hair root. Be cautious before you proceed with anything. Make sure you understand this concept. So with FUE, you take this rotating burr and you come in, and component number one is the doctor has to hit the angle correctly. You come in like this, you're just going to cut through the hair, and you're going to leave the root. When you pluck the skin off, you're going to get a piece of skin containing a hair but no root, and so nothing will grow. And when you look at this fellow's case, I think that a lot of the punches that were done not in the midline of his donor area were exactly that. There's scars in the skin, but there's hair coming straight out through them. So my best guess, and remember I was not there, is that he had a piece of skin removed with a hair sticking out of it, but no hair root. Component number two is you have to hit the right angle and go down, and then you free up the follicular root from the surrounding subcutaneous tissue, but at some point you have, either the doctor or the technician has to reach in and grab the tissue associated with the hair and pull it out. And if you could see how that little avulsion, you're avulsing the bottom of the root with FUE. Now, if you want to see this with plants, I have a video where I'm working with little potted plants in my backyard. Because when you buy little flowers at the garden store, they're essentially FUEs, except that the bottom of the container they come in is plastic, and so there's no avulsion. But even when you lift out those little plants, you have to be very careful with the root bulb, and the same with little skinny hairs. So if you're doing FUE and you have skinny hairs and there's just a little bit of stress to that root, the bottom of the root, those boys have a much higher chance of significant stress and decreased growth. Fatter trees or fatter plants or fatter hair roots tolerate that better. So my son had real thick hair roots, and we did an FUE on him to fix a scar. And when we pulled those grafts out, man, they were just like regular strip grafts, but he's got thick hairs. The fellow in this video has very fine hairs, and we do a fair amount of FUE at this office, but with these finer haired guys, it's the same as with plants. There's just less of a safety margin during that. And then the third issue with FUE is pertains also to strip, and that is the longer this hair is outside of the body, the quicker it's trying to die until you're getting it back in. So with a strip, for example, you take a strip out. I've got 7 or 8 people back there using microscopes to dissect the hair out, and we've got those hairs all back in the body well before 6 hours from the time they were removed from the body, and we keep them in cold growth fluid. With FUE, I start making holes at 8 o'clock in the morning, and I'll do extractions for 4 hours because I think that you got to have those hairs back in the body at by 6 hours. And so I can make however many attempts within 4 hours and feel reasonably confident that by keeping the grafts in a cool growth solution, that they will still be alive when we insert them. But a guy like this, or people that we see all the time, they'll say that the technicians were removing hairs for 10 or 12 hours. That means the first of those hairs that was taken out might be out of the body for 10 or 12 hours before it's put back in the body, and I think that correlates with decreased survival. And there are a couple of studies that would suggest that that's the case, but they're relatively poor studies, so I don't know that you can put a ton of science into that. But if you just think about it with plants, you take a skinny plant out and you lay it on your porch 5 or 6 hours and then try to plant it, it's not going to do as well as if you take it out and quickly move it to some nice moist soil. So that's the first issue I want to talk about, is strip versus FUE. How do you know how many hairs you got, whether it's strip or FUE? Well, this office, and I imagine in most reputable offices, they have, we all have sheets that each one of the cutters labels how many singles, doubles, and triples, because I don't count all the hairs. I just add up what the cutters account for. I have an idea of how many holes I made, and things ought to correlate. If I'm off at, if we have too many holes and not enough grafts, then there's a lot of number checking to do. But that generally doesn't happen at a reputable office. But with FUE, who knows how many grafts this guy actually got and how many of those grafts actually had hairs. I posted a case about a year ago, a U.S. military member who had paid somebody in our area for 6,800 FUEs, allegedly. I wasn't there. But he had a head full of scar, and he had paperwork to support his claims, and he may have had 400 hairs grown on top of his head. So this guy in particular paid for 3,500 grafts. You look at the pictures, he's got his own natural hair here in the middle. And he's got a few grafts. Much of this hair that's right here is miniaturizing end-stage hair, and he's thinning all the way back. Comes from a bunch of family, from a family full of class 5 hair loss. And when we trim him down, you can see the thicker grafts that he's paid for. Okay, so we trimmed down his hair in the front, and although I'm not a great camera person, you can see the grafts that he got after supposedly paying for $3,000. I will comment, and you can see it in the still picture of his donor strip. Right in the middle, there's a bunch of donor depletion. And I know that story, because what happens if you're having trouble getting grafts, well, you tend to go back to where you had the most success, which often is right in the middle, where the density is the best and the angle of the hair coming out of the head is the best. So my guess is that is where the best yielding piece of tissue was. So they took most of the hair there. They made holes laterally and got fewer hairs, either because of poor alignment or root avulsion. But I do not think this is 3,000 grafts. You know, he's got a lot of miniaturized hair that you can see here, but as far as thicker grafts hairs, you can count. There's just very few of them. So we'll hit him hard today and hopefully get better results. And you can see some thicker grafts in the middle and lots of miniaturized hairs. So our approach was to treat him almost as if he was a virgin head or a small plug repair, and really pack as much as we can in the frontal third. And try to avoid the hairs that he's already paid for. The next thing I'd like to talk about is donor depletion. With FUE, because you're making little punches all over the back of the head, there's lots of little white marks, and wherever you're successful in getting a hair root, there's no hair in that area. So look carefully at this guy, and particularly his strip. So this guy went to a place in Turkey. He's our third or fourth guy, and supposedly paid for 3,500 grafts. You can see he's got a fair amount of scarring in his donor area. Lots of little white marks. But the bigger issue is there just wasn't much growth up in the recipient area. So we'll take this strip out, cut out a bunch of his scar tissue, and it'll be interesting to see. I think a virgin head, we probably get 3,000 grafts. We'll see what we get out of this strip. Sew him up, and then we'll watch how the trichophytic closure compares to this over the course of a year. When we take his strip out, the center aspect of his strip really doesn't have any hair. It really has significantly less hair than you would expect in that area. And there's lots of little white marks. So my best guess is that when they were taking his FUE grafts, that's where they had the most luck, and so they kept going back and over harvesting there. He had punch marks all the way out to the sides everywhere, but there were a lot of hairs coming out through those punch marks. So my best guess is that they got the hair but not the follicle, and so he got scars. And a rootless hair transplanted. And so we got 2,700 grafts out of this guy. I bet if he'd had been a virgin head, we'd have gotten 3,200 grafts. So donor depletion occurs with FUE unless you spread things out. But it is harder to get hairs when it's not coming straight out of your head. I mean, I know this from personal experience. You know, you're trying to get somebody's hair, and you have really great luck in one particular area. It is tempting to go back and over harvest that area, because you know you're going to get it, you're going to give the customer hair, and you're going to get dollars for doing it, but you're doing it at the risk of donor depletion and future problems. So that summarizes our patient who had gone overseas, but he could have easily gone right down the street and gotten 3,500 FUEs with that fine hair and had very poor results. I mean, shoot, he could have even had it done here. We've had trouble with fine-haired guys. And it's that whole small tree, fat-rooted tree analogy that I keep going back to. So anyhow, I hope you learned something from this. I hope it makes sense to you. Lastly, once again, look at this sliver of scalp showing a non-homogeneous pattern of hair placement. You can see exactly where his FUE punch was successful in getting out a hair at his previous surgery. And then you can see where there's still a whole bunch of hairs left, but if you look from above, there's several scars that are right in it, so they clearly missed hairs. So lastly, just do a lot of research, make sure that you're getting the surgery you want. So we saw him back on day 3. And he looked pretty good. He'd done reasonable cleaning. And then we saw him again on day 7. And he did an excellent job cleaning. We took out his sutures, started him on scar care, and hopefully we'll see him in a month. So in conclusion, I hope you learned something in this video. We do lots of consultations in person and online. If you have questions, feel free to give the office a call. Thank you.